Hello. This is a YouTube video that's going to highlight two very important things in the med list that I want to make sure everybody is aware of. The first thing is there is these two columns here, outcome and outcome date. I actually learned about this when I went to the OP conference, and I was sitting with about, I don't know, 3 or 4 people around me, all of whom had been on OP anywhere from 3 to 6 years. None of us knew about these columns. So if you go over here to this little kind of, I don't know what you call this, little hash marks, little horizontal line kind of thing, and you click that, it shows you all the possible columns you can show. So you guys can kind of make this the way you want to look at it, the way you want it to be, if you have a preference on how you want it to look. But I want you to click outcome, an outcome date. I have clicked them, but yours may or may not be on. Go ahead and click those so that you actually have those columns visible. Okay. The reason for this is we really need to start using this on our med list. An example of how we could use this, what would be helpful, is let's say I put this kid on albuterol, or Mr. Spock, sorry, I put Mr. Spock on albuterol, and he got very jittery and had a lot of side effects, or maybe he had tachycardia. I could put in here tachycardia, side effect, heart rate, heart rate too high. So then you can see, wait, did that not work? Let me try that again. Tachycardia, heart rate too high. There we go. Okay. And we can say, let's say today's date. Okay. So what's nice about this is, let's say I've decided, okay, you know what? I'm going to have to put him on Xopenex because this is clearly not a good situation for him, and we need to try Xopenex so he doesn't have this happen. So let's say we do that, and we'll do this, chronic, and save. Okay. So now you can see the nice thing about this is if somebody else comes to look at this med list, maybe I'm on vacation and somebody's doing a refill for me, and they come and they look at his chart, they can very easily see, oh, okay, why is he on Xopenex? Oh, this is why. Okay, now I know. It's also helpful if we have to do a prior auth or anything like that to have this information here. You can imagine it's going to be helpful if a child's on a stimulant and you have changed the dose, or maybe you're weaning a child off of Zoloft and on to Prozac. You can put that information here so it becomes much more clear why med changes are happening. So that's the one thing that I really think we should start using. This would be a place if you wanted to put an allergic reaction, you could put that here. If a parent spilled the amoxicillin and you needed to fill it again, you could put that here. So it would explain why amoxicillin shows up once and then again like 4 days later. The place that I used to put this information was in the notes and visibility right here. But the problem with that is this. If you put a note here, let's say, I'll put that there. Okay. I have this set to extra notes, so I see it. Okay. But if I don't have this clicked, I'm not going to see it. So not all of us will necessarily notice that extra note. So that's the other reason I think this is a good place to put it. So I would encourage everybody, please add these two columns, and then we should start using these. The one other thing I want to mention is this this chronic designation. As you've probably noticed, sometimes it looks like OP doesn't know how to sort dates, and part of that is because it puts all the chronic meds at the top of the list. But sometimes we have to do a little bit of cleaning up. Like I've just decided to put this kid on Xopenex. I need to go through and manually say, okay, you know what? This is no longer chronic. The other cool thing is that let's say I decide I want to refill this Xopenex. Okay, so it's listed as a chronic med. I hit the refill. I want you to see what it did. It has automatically changed the new one to yes and the old one to no. So I will admit what I was doing is I was coming in here and actually I'm not sure what I was doing, but in any case, I ended up with a whole bunch of medicines marked as chronic. Like I'd have 4 sertralines as chronic, or every Vyvanse script I've ever written is chronic. But if you actually do, OP is actually smart in this manner. If you click the med and you hit refill, it will automatically make the old one, switch the old one down to not chronic and make only the new one chronic, which makes your med list much easier to look at than when you have a lot of ones that shouldn't be there. Anyway, I hope that helps. Thanks. Bye-bye.